You're watching CTOM TV. Knowledge is power.
Each of you have probably had some experience either as a patient yourself or as an advocate trying to work with your oncologist or a radiologist or a surgeon, trying to get some time with them to be able to ask some questions and trying to get a sense of confidence that you're being treated as an individual and not just a body or a number. And a lot of times we hear that's a big challenge, and there's lots of reasons for that. The numbers of patients doctors are expected to see is just so high, and the amount of time they actually have to spend with you is so low. So it's difficult for them to be really thorough, but of course it matters that they're thorough. So one of the things that we do for people is we actually, not only do we gather these diagnostics we're talking about and make sure that their doctor has more accurate information to work from and that you know what treatments are going to be best for you, but we also really help to organize and prepare your medical history and this information so it's highly accurate and succinct so that your oncologist can make the best use of it. And I just wanted to put a little list here for you to just have a glance at it, the things that are important to make sure are happening in terms of whoever's looking out for you. This kind of information is the stuff that you want to make sure that they're looking at and putting together for your doctor so that it's very easy for them to know with confidence what's going to suit you best and how to get it for you. And this is also, again, in that PDF, so you don't have to write it all down.
Before you change the page, Michelle, I think you brought up an excellent point there. Point number 3, how your specific mutations interact with each other. Mm-hmm. I think this is something, while we do see a lot of development in precision oncology, this is one thing that is not really, that a lot of attention hasn't been put into. Is how one mutation in one set of genes affects mutations or affects other genes. And I think that's a very important point that you brought that up, because it needs to be addressed in everyone's situation.
Yeah, because it can affect the way your treatment works, exactly. Or if it works at all. If you can target one mutation and then another one can become more virulent if it's not targeted simultaneously. So, I mean, I know we've seen it happen, sadly. So.
And I think an excellent example of that is how mutations in KRAS and PIK and other genes like that can affect drugs that target EGFR inhibitors.
Right.
EGFR mutations.
Right. Or is that partly what we were talking earlier about how they test for BRAF, because yes. That might affect the how is that what you're referring to there?
Yes. Yeah. So just to recap on that. Standard colorectal cancer treatments require that you have a PIK test, a RAS test, and a BRAF test, because if you have mutations in those genes, then you can't get the EGFR monoclonal antibodies. And EGFR monoclonal antibodies are targeted drugs that target EGFR overexpression in colon cancer. Mm-hmm. So that's
the belief is those won't work for you if you have those mutations.
Yeah. Yeah,
we're going to talk more about that. Right, of course. We're going to talk more about how to get around that shortly when we get
will, yes.
Mm-hmm.
Yes.
Thank you for watching CTOM TV. Subscribe below and stay informed.